Have you ever wondered how chemotherapy, a common treatment for cancer, actually works in your body? It's a fascinating, albeit complex process that involves a strategic battle against cancer cells. Let's embark on this journey to unravel the mystery of cancer chemotherapy. Imagine a battlefield where the soldiers are the chemotherapy drugs, and the enemy is the cancer cells. These soldiers are trained to target and eliminate the enemy, but in the process, they may also impact innocent bystanders, which in our scenario are the healthy cells. This collateral damage is what leads to the side effects of chemotherapy, but we'll delve into that a bit later. You see, the world of chemotherapy is not a one-size-fits-all. There's a whole arsenal of chemotherapy drugs, each with their own unique strategies and attack plans. Some of these drugs, known as alkylating agents, directly attack the DNA of the cancer cells, preventing them from replicating. Then there are anti-metabolites that trick the cancer cells into accepting them as normal building blocks, only to sabotage the cell replication process from within. We also have anthracyclines, which intercalate with the DNA, disrupting the normal functioning of the cancer cells, and topoisomerase inhibitors that prevent the DNA from unwinding, thereby stopping the cancer cells from dividing. Mitotic inhibitors, on the other hand, prevent the cancer cells from undergoing mitosis, the process of cell division. And then there are corticosteroids, which help reduce inflammation and work in conjunction with other chemotherapy drugs to increase their effectiveness. But remember, this is just a broad overview. Each of these drug types has its specific actions and potential side effects, with some posing risks like heart damage or nerve damage. In the upcoming scenes, we'll dive deeper into the individual workings of these potent drugs and explore the side effects and the newer, more targeted therapies. Now that we've set the stage, it's time to dive deeper into the workings of these potent drugs. So how do these chemotherapy drugs wage war against cancer cells? Glad you asked. Let's dive into the fascinating world of these cellular soldiers and their strategies. Chemotherapy drugs are like special forces, targeting cancer cells at different phases of their life cycle. Their mission? To disrupt the growth and division of these rogue cells. The cell cycle, you see, is a series of stages a cell goes through to divide and reproduce. It's like a cellular assembly line, and these drugs aim to throw a wrench into the works, stopping cancer cells from multiplying. But not all chemotherapy drugs are the same. They come in different varieties, each with their unique mode of operation. Let's take a quick tour through the broad categories. First up, we have the alkylating agents. These guys are the saboteurs. They work by damaging the DNA of cells, which prevents them from reproducing. Next, we have anti-metabolites. These are the master impersonators. They mimic the substances that cells need to survive and reproduce. Once they're inside the cell, they prevent these processes from happening. Then we have anthracyclines. These agents interfere with enzymes that are involved in DNA replication. They're like the locksmiths, changing the locks so the cell can't access its own genetic instructions. Moving on to topoisomerase inhibitors. These agents are the code breakers. They interfere with the enzymes that help separate DNA strands during replication, essentially scrambling the cell's instructions. And lastly, we have mitotic inhibitors. These are the gatekeepers. They prevent cells from moving into the next stage of the cell cycle, effectively halting their growth and division. Each of these categories has a unique way of disrupting the life cycle of cancer cells, but they all share the same goal: to stop cancer in its tracks. While these drugs are fighting the good fight, they can sometimes affect healthy cells too. But that's a topic for our next segment. Stay tuned. What happens when these potent drugs interact with our healthy cells, you might be wondering? Well, that's where side effects come into play. Chemotherapy drugs are designed to kill cancer cells, but in their mission, they can also affect healthy cells. This is because these drugs target cells at different phases of the cell cycle, a cycle that isn't exclusive to cancer cells, but is also a part of the life of healthy cells. Imagine a bustling city, with its workers diligently performing their roles. Now picture a storm sweeping through, disrupting the city's operations. That's chemotherapy for you. It storms through the body, disrupting not only the cancer cells but also the healthy ones. Now let's dive into some of these side effects. One common side effect is nausea. This is because the drugs can affect cells in the lining of the stomach, making you feel sick. Fatigue is another common side effect, as the drugs can affect your body's ability to make new red blood cells, leaving you feeling tired. Hair loss is perhaps one of the most well-known side effects of chemotherapy. This happens because the drugs can affect the cells responsible for hair growth, leading to hair falling out. But it's important to remember that this is usually temporary. and your hair will grow back after treatment. However, some side effects can be more serious. For instance, certain types of chemotherapy drugs can pose risks like heart damage or nerve damage. Heart damage can occur when the drugs affect heart cells, potentially leading to conditions like heart failure. Similarly, nerve damage can occur when the drugs affect nerve cells, leading to symptoms like numbness and tingling in the hands and feet. It sounds daunting, doesn't it? But remember, not all hope is lost. There are ways to manage these side effects. Anti-nausea medications can help with sickness, and rest can help with fatigue. For hair loss, there are options like wigs and scarves. And for the more serious side effects, regular monitoring and adjustments to your treatment can help. Moreover, new treatments are being developed. These aim at targeting cancer cells more accurately, reducing the impact on healthy cells, and thereby, hopefully, reducing these side effects. But remember, not all hope is lost. There are ways to manage these side effects, and new treatments are being developed. What if we could target only the cancer cells, leaving the healthy ones unscathed? Imagine a treatment that's like a guided missile, zeroing in on just the cancerous cells. That's the promise of targeted therapies. While traditional chemotherapy is like a carpet bombing, affecting both healthy and cancerous cells, targeted therapies are designed to interfere with specific molecules necessary for tumor growth and progression. These therapies home in on the unique characteristics of cancer cells, sparing the normal cells, and in turn reducing the side effects. You see, each cancer is unique, just like a fingerprint, and it contains certain proteins or has mutations that set it apart from normal healthy cells. Targeted therapies are designed to exploit these differences. They come in many different forms, including small molecule drugs or monoclonal antibodies, which are like the body's own immune system weapons, but supercharged. Now, it's not all sunshine and rainbows. Targeted therapies have their own side effects, and they don't work for all types of cancers. Some cancers have proven tricky to find a suitable target, while others develop resistance to these therapies over time. But when they do work, they can work wonders, shrinking tumors, and improving the quality of life for patients. And the best part? Targeted therapies are just the beginning. As we speak, scientists are exploring new frontiers in cancer treatment, like immunotherapies that use our own immune system to fight cancer, or gene therapies that could correct the genetic mistakes that lead to cancer in the first place. As science progresses, we move closer to a future where the battle against cancer becomes more precise and less taxing on the body. The war on cancer is far from over, but with each passing day we're developing more effective weapons to fight it. So, what have we learned about the intricate world of chemotherapy? It's a realm of medical science that exemplifies the complexity of the human body and the intricate dance between disease and cure. We've delved into how chemotherapy drugs work, unraveling their mechanisms in targeting cancer cells at different phases of the cell cycle. These powerful medications, while focused on eradicating cancer cells, can also affect healthy cells, leading to a variety of side effects. We've explored the different types of chemotherapy drugs. Each type, whether it be alkylating agents, anti-metabolites, anthracyclines, topoisomerase inhibitors, mitotic inhibitors, or corticosteroids, has a unique mode of action. Some disrupt the DNA of cancer cells, others inhibit cell growth or block certain enzymes. Yet each drug carries its own potential side effects, from the more common nausea and fatigue to more serious risks like heart or nerve damage. The side effects of chemotherapy, while challenging, are part of the body's response to these powerful drugs. They are temporary, often treatable, and fade after treatment concludes, serving as a testament to the resilience of the human body. And then, there's the beacon of hope in the form of targeted therapies. These treatments focus on specific substances within cancer cells, bringing a new level of precision to cancer treatment. It's a rapidly evolving field that promises to make chemotherapy more effective and less challenging for patients. In the face of cancer, knowledge is power. Understanding chemotherapy helps us appreciate the complex battle being waged within the body, and the ongoing efforts to make this battle more effective and less challenging.